My name is Solomon Musemi, and I'm the president of Care for a Child's Heart. Earlier this year, I decided to run 2,020 kilometers, which is about 1,254 miles, in support of the organization. And basically, my goal is to raise $50,000 that shall go directly towards the programs that we sponsor. So far, I've done about 800 kilometers, and by the end of the year, it is my objective to meet that target of 2,020 kilometers. The reason I decided to run is because I have been running for very many years. I've been running for at least 20 years now. And it occurred to me how fortunate I am to have a good working heart. And so I decided to use my heart as a blessing to other people whose hearts may not be working as well. And so therein came the idea of running this long distance during the course of this year to fundraise for the children. We've set a goal of $50,000 by the end of the year. You can sponsor this particular project by going to the website Care for a Child's Heart, which is cfach.org. And under that banner, you will see a section labeled Run with Solo, where there are different levels of sponsorship that you can sponsor. And every dollar that is contributed will go directly towards the Care for a Child's Heart programs. I'm a practicing attorney. I grew up in Kenya. I came to the United States and went for studies in the US. I have been practicing law for close to 18 years now. In addition to practicing law, I feel very passionately about philanthropic work. I am blessed with 3 children, and I live in Houston, Texas, and I've been here for the last 20 years or so. I went to school in Lenana High School in Nairobi, Kenya, and attended primary school at Catholic Parochial, right there near Holy Family Basilica in downtown Nairobi. And I'm still very attached to Kenya, and in spite of all the challenges that our country faces, I passionately believe that the future is very bright for Kenya, and that it's our responsibility, each and every one of us, to do our part to contribute and to help Kenya to advance to a better future. Care for a Child's Heart is an organization that is geared towards providing heart surgeries for children who live in developing countries. Our mission is to facilitate and coordinate the medical support programs for marginalized children that are affected by heart disease. That is the mission for Care for a Child's Heart. We have been operating for a little over 20 years, and we have provided over 210 surgeries for children in Kenya, mainly in Kenya. But we also have the Family Support Center that is based in Nairobi, in South B, where the children come from rural areas, and we house them. We provide food and housing for the children as they get ready for surgery. Sometimes we have children who are just physically not able to undergo surgery due to malnutrition. And so we undertake upon ourselves to feed them and prepare them. Some of them need dental work before they go for surgery, because surgery, if you have dental issues, for example, many surgeons will not allow you to undergo heart surgery. So we try and do all the preliminary work that needs to be done before the children are presented for surgery. We work with Hearts of East Africa, which is an organization that's based in Tennessee, who provide surgeons and pediatric surgeons and other experts who come to Kenya and perform the surgeries at Tenwick Hospital. We also work with a group called Chain of Hope, who are based in England, who send surgeons to MP Shah Hospital and do surgeries over there. We also partner with other organizations such as Heart Gift, which is based in Austin, Texas. Also involved in providing heart surgeries for children. The Heart Gift program, basically, they bring children from outside the United States, and the surgeries are performed in the United States. But through our partnership with them, we've been able to conduct many of the surgeries in Kenya, which in turn has increased the number of surgeries that they're able to do, given the fact that it's much cheaper in Kenya, and also you don't have to deal with the cost of transporting and housing the patients when they get to the United States. And so through coordinating our efforts with other organizations, we believe that in the future we'll be able to do a lot more for the Kenyan community in Kenya, but also we do provide services to other children who come from other countries. Just last year we had a patient who had come from Cameroon. We had another patient from Uganda that we took care of. And at times, certain patients who are headed to India, for example, for surgery. For example, 2 months ago, we had 2 patients who are coming from Sierra Leone, and they stayed in our center for a couple of days before they proceeded to India. So there are a lot of other things that we do over and above providing heart surgeries that enable children who could not have access to healthcare get access to the healthcare that they need. In addition to being a sponsor of Run with Solo, which is a campaign that we've undertaken, there's also another program where you can sponsor a bag. A typical bag costs about $250, and in that bag it contains the medicines for 3 months. We also provide basic toiletries and blankets, and also materials for the family on how to take care of a patient after heart surgery. That bag will also be on sale on our website, where you can purchase a bag to support a patient who is undergoing heart surgery. I grew up in Kenya, and over the years I have witnessed the suffering of many of the people who are at the lower income levels, who do not have access to good health care. As soon as I was introduced to this organization, I felt very passionately about the cause. I have been to Kenya on many mission trips, and I was particularly touched when I went to Kenya in 2019, where we were able to visit the homes of where many of these children come from. I accompanied many of the patients all the way to Tenwick, and I was even given an opportunity to witness a heart surgery taking place. It reinforced to me how important this work is and how impactful it is to the little children, many of whom would not survive without surgeries. Healthcare in Kenya is very, very expensive and is almost inaccessible to people at lower economic levels. Having joined this organization, we believe that in the long run, we will be able to support healthcare programs that will give access to healthcare to the least amongst us and those who have economic challenges. Indeed, at times it seems overwhelming when you look at the number of people that are at the lower income spectrum in Kenya, but we have to start somewhere, and great things begin with very humble beginnings. And so I do believe that as we work towards eradicating congenital heart disease in Kenya, we shall be able to expand the program so that more people can have access to healthcare, particularly those who are suffering from heart diseases, many of which are easily repairable.